Assalamu alaikum, dear students. How are you? Can you hear me? Is my voice clear? And can all of you see the slides? Okay. So basically, we are going to start this new course. Is Introduction to Public, basically the Public Health Informatics. So in this course, I already discussed about that what you supposed to, what are the outcomes that we are going to achieve at the end of this course. And I already discussed about the textbooks that you should read. And this week we are going to follow the chapter 1 from the textbook. And I hope that all of you got your textbook, and you have you can either find the textbook in the paper format or electronic format. Have you got your textbook? Okay. Okay. So the thing is that the textbook is it's nice to have the textbook with you in the paper format. Can you all hear me? Okay. So the thing is that in this course we will refer to some of the chapters from the textbook, and I will discuss about the course, the assessment, that is the coursework. So the coursework will be 25%, and the midterm 25%, and the final exam will be 50% of the full course grades. So the coursework will include assignments and discussion board questions, as well as some projects, maybe some quizzes. So still I didn't get or we didn't get any information about the number of assignments, and inshallah I will update about the assignment for this. Is there any assignment for this week or next week? And I hope some of you have did the introduction part in the blackboard. About you have discussed about some of you, and then some of you have discussed about what you are doing. And I think thanks for updating your information about the branches that you are attached to. Okay, so you should avoid sharing the copyrighted books because it's a copyright issue. So I think it is better to have the book with you. Okay, and in this week we are going to talk about our objective of this week is to define the concept of public health informatics and explain the aspects that it has in common with medical informatics. So there are two branches of this health informatics. One is the public health informatics, and the other one is the medical informatics. So medical informatics basically related to the patient's level, and when it comes to public health, of course, it's related to the population health. And then the second objective is to understand the four principles that define, guide, and provide the context for the type of activities and challenges that comprise public health informatics, and differentiate it from the medical informatics. And then third objective, we will explain how the four main drivers of the change are affecting the future of the public health informatics. Basically, the technological changes which are affecting the informatics. And then we will discuss the major the importance and immediate relevance of informatics to public health. Okay, so I'll try to cover most of the objectives in this week, and then some of the objectives I'll try to cover in the next Tuesday session as well. So the purpose of the public health is, give me a second. Okay, so the purpose of the public health is having several aspects. It's shown in this picture. You can find it starts with monitoring health status to identify and solve community health, public health activities. And the second purpose is to diagnose and investigate public health problem and health hazards in the community using the available diagnostic methods such as the laboratory diagnosis. So the second aspect, the purpose, and the third purpose is to inform and educate and empower the people about the health issue. So that is third purpose, and the fourth purpose is to mobilize community partnership and action to identify and solve health problem. So this is one of the purpose. Okay, I think all of you can hear. Maybe you should check Abdul Rahman. You should check your the computer with that. And the sixth purpose is to enforce laws and regulations that protect health and ensure safety, and then linking the people to need personal health services and assure the provision of health care when otherwise unavailable. Can you hear me? Is it clear? Okay, so the next purpose is to assure competent public and personal health workforce is to enforce or the assuring the competent public and personal health workforce, and then evaluate effectiveness, accessibility, and quality of personal and population-based health services, and also it's include research for new insights and innovative solutions to the public health. So those are the purposes of the public health. So public health is basically deals with the population health. So when it comes to some problem which is it can be dealt with the public health response, it should satisfy these three characteristics. So it should be able to be preventable, and it should be able to prevalence and the severity of the problem. When it comes to the severity, the condition or the disease must be severe enough in its efforts to warrant some type of intervening or monitoring. And when you say the preventability, the condition must be preventable or at least able to be mitigated by the public health interventions or the behavioral modifications of the population, etc. And when you say its prevalence, the condition must be prevalent enough in population to warrant some type of intervention and monitoring. So a condition which should be able to be responded by the public health should satisfy these three the conditions, like as we explained here. Okay. So now we come to the introduction of the public health informatics. So the personnel who are involved in the evaluation or the development of the informatics solutions. Okay, so as per the text, the public health informatics or the informatician is a professional in the systematic application of information and computer science and technology to the public health practice, research and learning. So a personnel who is involved in, who has one feet in the public health and the another feet in the information technology. So the person who involved in this public health informatics activities should be able to satisfy the knowledge with the public health as well as the information technology. So the personal e-health or the electronic health priorities which should have the in his context are these. So the e-health priorities can be basically its prime base is the public health system, which that is the main priority, and he should be able to relate with the administrative system, and he should have the background of the clinical system. But the personnel who involved in the health related activities are the ideal person to become the PHIs or public health informaticians. So they develop their priorities using by the research system, which has its own feedbacks. So the scope of the public health informatics include the conceptualization, designing, development, deployment, refinement, maintenance, evaluation of the communication, surveillance, information and learning system. So the person who involved in the development and conceptualization, designing and deployment and refinement, maintenance and evaluation are called the public health informatician who satisfy the scope of the public health informatics. So the public health informatics has two primary disciplines. One is the computer science, that is the theory and application of automatic data processing machine. And the other discipline it satisfies is the informatics science, that is the analysis of the structure, properties, organization of information storage and retrieval, information system and database architecture and design. So the scope has two primary disciplines. And now let's see what are the distinctions between the medical informatics and public health informatics. The public health is concerned with the health of the population. So you know that public health is involved with the health of the population, while the medical is involved with the personal level. So the public health informatics involves focusing on applications of information science and technology that promote the health of population rather than the individuals. And this focus on disease prevention at the population level rather than an individual level. A focus on preventive intervention at all vulnerable points in the causal chain which is leading to the disease, injury or disability. So the intervention can be in any way of the causal chain, okay, or ultimately it results in the injury or disability. And basically this public health informatics operates typically within the government context. It's not related to individual personnel. It's related to the government. So there is a lot of policy involved in this public health informatics. So the public health, these are the four fundamental concepts involved in the public health informatics. One is it's related to the population health rather than the individual, and it's focused on the disease prevention rather than the cure of the patient. It's focused on preventive interventions in any point of the chain of the reaction, and it's always involved with the government context. So as you can see in this table, this differentiate between the public health and the medicine. The medicine, as you can see, I don't want to read all these things. So the source basically in the medicine is clinicians and health practitioners, while the public health is by the government or the organization and agency. And the primary focus of the medicine is to personal disease curing, while the public health is the population level disease prevention. And the primary strategy of this medicine involved the treatment of the disability, while the public health is the prevention of the disease. That is the primary strategy. And the timing of the action, that is also very important. In public health, it's before the illness comes, that is the prevalence, or at the level of the primordial prevention. Sometimes it's called while you do the surveillance, you prevent the disease. But in medicine, it's after the illness or the injury is developed. That is the treatment occurs in medicine. But in the public health, the involvement or the interventions occurs before the injury takes place. And the context is clinical or surgical or any type of subtype of that. But in the public health, any vulnerable points in the causal chain, such as mood, includes education, policy research, monitoring, assurance. When it comes to the operational context, it is in the private practice or clinicals in the hospital level, while the public health involves the government context. So those are the differences between the public health and the medicine, as well as its differentiate the public health informatics from the medical informatics. So the electronic health record that we are using is basically involves with the medical informatics, but the public health informatics, it's like aggregated level of data analysis system. Okay, there are some similarities of the public health and medical informatics. So these are the important things that you should remember when it comes to the exam point of view. So these both the medical and public health seeks to use the information science and technology to improve the human health. And the lessons which are learned in the medical informatics are applied in the public health informatics, and there are informatics applications for which there are no real distinction between public health and medical informatics. So the four principles, again in detail. So according to the text, there are four principles of the public health informatics. One is the focus of public health informatics in an application of information science and technology that promote the health of population as opposed to the health of a specific individual. Second principle is another focus of public health informatics, an application of informatics science and technology that prevent disease and injury by altering the conditions or the environment that put population or individual at risk. And the third principle is public health informatics application which explore potential for prevention at all vulnerable points in causal chain leading to the disease or injury or disability. And the fourth principle is reflects to the government context, or it's related to the government context rather than a hospital setup or individual private clinic. So basically I would like to stop here, and do you have any questions? I will start the presentation from here. in the next virtual session. Do you have any questions now? Okay, now basically I'm going to take the attendance in the middle of the session. So I'm going to take the attendance now. So don't leave the session until I take the attendance. Actually, I would like to get your feedback. Can you hear my voice, and is it clear? My English is clear. Any problem, you can just write. Just if you can't hear my voice, am I going too fast or am I going too slow? So anything like. Okay, so I would like to go back to the objective so that we will see that what we have covered. So the first objective is to define the concept of public health informatics. As related to the medical informatics, we saw the distinction between public health informatics and the medical informatics. As well as we talk about the 4 principles which underpin the public health informatics. So the first principle is that the public health informatics focus on the population health rather than the individual health. Okay, let me come to that slide so then it's easy. Okay, so the 4 principles of the public health informatics is which promotes the health of the population rather than the individual, and this prevents the disease or injury rather than the curing the disease. And the third principle is interventions are any of the vulnerable points in the causal chains which leads to the disease. And the fourth is always reflects to the government context. So those are the 4 principles behind the public health informatics. So when you target some problem which can be achieved by the public health interventions or public health informatics interventions, it has to satisfy all 3 conditions. So those 3 conditions are given here. The conditions should be able to be preventable by the public health interventions, and it has to be in a prevalence where it's large number, so that can be involved in the context of the government level, and it has to affect in a kind of a severity, so that if it is less severe, then we don't need to intervene anything as a population health. So the condition has to satisfy all 3 area. And then we talk about the public health informaticians, the basic definition, and we will learn the definitions later. And his e-health priorities, not only the public health system, but he has the priorities in the clinical context and as well as in the administrative context. And the scope of the informatics, which is a vast, it's kind of conceptualization, designing, development, deployment, refinement, maintenance and evaluation. So the scope is like a huge area of the public health informatics. And the public health underlies computer science and the informatics science. So a person who is advancing in his career in the public health informatics has to have thorough knowledge on public health as well as in the informatics science or the computer science. Do you have any questions? So I will stop here, and then we will basically we will move on to the next topic or next drivers of the public health informatics changes. So we will see that. So I'll advise you to go and read chapter 1 from the book, and try to get the book and take a printout. Just read it first chapter, and you will understand more on that. Okay. Thank you so much for attending. If you have any question, I'll give you 10 minutes. Otherwise, you can even you can leave the session. No problem.